Welcome back to WTLL 11 Your Day. May is Mental Health Awareness Month, and this week we bring you resources that are available to everyone who needs them. But how do you know if you need them? Katie Phillips of the Thomas M. Wernert Center in Toledo can help this morning. Good morning, Katie. Thanks for joining us today.
Oh, thank you so much for having us.
Absolutely. This morning we are focused on mental health literacy. What exactly is that?
Well, mental health literacy, if we look at the word literacy itself, that means it's a set of skills for reading and writing. So you need to know more than one thing to be able to read. And so, therefore, we came into health literacy, which is being able to read prescription bottles, appointment cards, being able to follow instructions of a doctor. And so now we are really into mental health literacy, which is a whole I think for everyone on the planet, actually everyone in the community has mental health. We have mental health every day. And so sometimes we're doing really well and we don't need any help. Sometimes we might have stress or distress, and if we don't do some stress busting, which Donna's going to talk about tomorrow, then we might get overstressed and overburdened, and that could lead to a mental health problem. And when it becomes a problem, then we want to be able to go to a therapist and speak to somebody who has an unbiased opinion and an objective look at what we're going through and give us tips and tricks on how to get through what we're going through. Now, then we could have a mental health problem, and anybody can have a mental health problem. That would be something like a death of a loved one, a really bad divorce, maybe a major medical diagnosis. So then that's when you would really seek out help from a counselor to help you navigate what you're going through and get back to your normal balance. And then we also have mental illness diagnosis, and that is a medical diagnosis of a condition of our brain. So something's off balance in our brain. Our neurotransmitters are not working the way they should. And so in order to correct that, we have to have a diagnosis and treatment. But what we need to know, though, is that we can go and get help when we have any questions whatsoever about our mental health. Some things are normal and regular, and other things, such as symptoms of depression or schizophrenia or bipolar disorder, really need to have that medical treatment in order to be in mental health recovery.
And that intervention, so if we are mental health literate, that, makes us a little more aware of maybe what it is that we are dealing with. Maybe this is stress. Maybe this is a mental health problem. Maybe this is a mental health illness. So it's so important that we understand what all these things mean.
Right, and so we can seek help when we need it. We can be aware maybe when we need to have our children assessed. If we think that they're not developing correctly, that's very important to help that child get through school and things like that.
And I think that if we educate ourselves, they say knowledge is power, and I think that it also helps to decrease the stigma. And I think that hopefully we are breaking away at that, and we are chipping away at that stigma, because like you said, we all have mental health, and we all are going to be going through different things at different points in our lives. So, we all are going through that together, aren't we?
Right. We all have a brain, right? So we want to keep it healthy.
Right,
so we
exactly.
need to be aware of the things that help keep us healthy.
So, Katie, if people want to learn more information about what you all do there at the Wernert Center, how can they reach out?
Well, they can call us, or many case managers will make appointments and take a tour. We're open every day from 9 to 4, and we're here, and it'd be great if you stop by. And our Facebook social media, you can go on Facebook and search Thomas M. Wernert Center, and we have lots of good information there about what's going on at the center and what our members are doing, and how they're doing in their recovery. So, and there's also other ways to learn about mental health literacy. Like, for example, NAMI of Northwest Ohio has the Family to Family course for family members of for a loved one that has a mental illness. And then we also have mental health first aid. And then also there are great websites, SAMHSA, Mental Health America. So there are websites that you can go to and just click around and see what's going on there and see what they're saying about things.
Yeah,
so
educate yourself.
There are many ways to become educated.
Yeah, lots of resources out there. Katie, thank you so much for joining us this morning. We appreciate it.
Okay, thank you, Amanda, for having me.
You bet. Take care. And if you are struggling with your mental health, there are people who can and are more than willing to help. You can text the word support to 419-248-1100, and we will send you a link to resources that are available to you. WTOL 11 Your Day is back in a moment.